All right, so thank you all for joining me for this group consultation class. I am Renee Dyson, registered nurse, okay, the founder of New Nurse University, Inc. And today we will be discussing how do I start studying again, okay? You guys were emailed a brain dump study plan. This is where we're going to put all our ideas out on paper, okay? I think it's very efficient if you brain dump and just get down the techniques that you need to learn on paper so you have something to go back to and you won't be saying, you know, what did she say again? Or you won't be trying to write in a notebook with scattered pages and then you lose the notebook and then find it 2 weeks later and be like, oh, this is what you said. Okay, so if you printed out your brain dump study plan, this is what I want you to write on. We're going to go through everything, and some things will be tailored to students and their syllabus. I will let you know when it is. And then some things will pertain to NCLEX, okay? And I just need you guys to know, wherever you are in your nursing journey, guess what? The content never changes. The core nursing content never changes, okay? With that being said, if you study by subjects and not comprehensively at first, then you can build a better foundation of critical thinking and knowledge. Let me say that again. If you study by subjects, if you just focus on one subject at a time, you can build a better foundation, okay, of critical thinking, okay, and knowledge. So I'm really big on repetition. You'll see me post in a group. Repetition is key to consistency. NCLEX wants you to be consistent. Okay, when you get to NCLEX, when you even on your nursing school test, they give you a percentage, right? You got to get so many right versus so many wrong, and then they give you a percentage at the end. Well, NCLEX is kind of like that, but they're not based on percentages. It's based on how you answer those questions. NCLEX is like, they want you to be consistent no matter when they give you the question. So like if you have a nursing school test, right, and it's all on renal, renal, respiratory, and endocrine. Those are the basic topics that you need to know. Those are the basic topics that you're going to focus on. But NCLEX, no, it's comprehensive. And the way that you get like solid in order to be consistent is by studying by systems, okay? So let's get started. The first thing on your brain dump study plan says weak areas of content. Now, I always ask this question, and everybody always tell me the same thing. I don't know my weak areas. Yes, you do. Stop playing. Yes, you do. You always have a subject that you just hate. You just loathe it. It's not interesting. You don't want to study it. It's boring. That's the one you start with first. That's your weak area because you hate it so much, right? You would rather study dosage calculations rather than study pharm. Okay, like you have to start with your weak areas. So when you start studying again and you are trying to focus on your weak areas, you ask yourself and write this down. What do I struggle with the most? Okay, so right next to weak areas of content, write down, what do I struggle with the most? And then guess what you got to do? Answer it. Answer the question. Okay. What do I struggle with the most? Make a list right now. I want you to put 3 things on this paper that you struggle with the most.
Okay. Do you want us to put the subject as well, or?
Yeah, you can. 3 things. Okay. Now, So the technique to conquering the things that you study, that you struggle with the most, is you start studying that first. Okay? Start studying it first. Now, if you're studying for NCLEX, okay, that's going to be at the top of your list. You're going to make a list of everything that you need to study. And let's be honest, you do have strong points, okay? Do not sit up here and say, I'm weak in everything. It's so vague. Like, no, you are strong. But if you just refresh it, everything's going to come back because it was in your memory, right? Sometimes certain things just take you to refresh it and it comes right back like this. I mean, like, you had a recipe, right? A recipe book. And you learned how to make spaghetti some years ago. You haven't made spaghetti in years. By you repetition making that spaghetti recipe, but you stop making, you go back to making, it's like you're gonna know all the ingredients, right? You're gonna know how to put the ingredients in, and you're gonna know what time to cook it and how many minutes until you're serving it. It's all gonna come back because it's in your long-term memory. You have to start studying those 3 things that you wrote down, or whatever list of weak areas you have to start studying them repetitiously in a way that is stored in your long-term memory. Okay. The thing that I hate the most is people memorizing. Don't memorize. You have to learn it. Learn it enough that you can teach it to somebody else. If you can teach it to somebody else, it's in your long-term memory. Does that make sense?
Yes.
Okay. Memorizing, you're not going to remember it in 30 days. That's the difference. That is the difference. When you memorize, you have all these flashcards and you're going through them and all that, in 30 days, if you put them flashcards down today and you don't touch them for 30 days, you're not going to remember half the stuff in those flashcards. But if you make it a habit to, let's say, post something on your refrigerator, and every time you open up your refrigerator, go get something to eat, guess what? You looking at it. You looking at it. You looking at it. If you do that for 30 days, it's in your long-term memory now. Even when you take the flashcard down from the refrigerator, you're going to remember that flashcard on the refrigerator. Like, what used to be there? Oh, my fluid and electrolytes, right? You have to do things in a way that's repetitious to you, okay? And don't make it so boring. So, it says weak areas of content. You wrote down, what do I struggle with the most? You name 3 things, and that's what you start with. Okay? That's your technique every time. So don't come back to me saying, I don't know how to start. Yes, you do. Yes, you do. Write down 3 things and start there. Okay? The next thing. So you have to recognize what your bad study habits are. And that goes for if you're taking NCLEX or if you're taking a test. Okay? So that's your technique. Recognize what your bad study habits are. So what's the solution for that? Bad study habits. Actually, before we get to the solutions, I want you to write down 5 bad study habits that you do. During your tests, during studying, write them down. Write down 5 bad study habits that you do. And it could be anything. Writing down rationales to questions and never going back. NCLEX graduates do that. They write down everything and then never go back to it. And I'm like, why? Why do you do that? I don't know. Or they collect remark, they collect marquee, they collect 35-page study plan. they collect this, they collect that. And then how you gonna study all this stuff? You collecting all these resources, but for what? You never go to them. Okay. So students, take this as a note. Don't do that. Don't collect from everywhere. You stick with a source and you stick with it throughout your whole entire. I still use Founder's book, and I'm a nurse in Ellen. I still use my Founder's book. So you stick with your resource. Okay. So
I'm in a class.
Let's see. Everybody got down their 5 bad study habits?
Well, I have 3.
Okay.
I got 4.
We're going to find 2 more for you and 1 more for you.
I'm sure it's there.
Okay. So, you wrote down your 5 best, or you wrote down your study habits. Now, what's the solution for them? Does anybody know?
Well, one of mine was putting studying off after 15 and 20 minutes. And then say I'm going to go back to it, but it'd be like hours later.
Oh, you're a procrastinator.
Yes.
Procrastinate sometimes. Okay. So, how do we break our bad study habits? You create a solution and you practice it. That's your technique. You create a solution and you write that down. Create a solution and you have to practice it. You can't create the solution and then never do nothing about it. That doesn't make sense. That doesn't go together. You create the solution and you practice it. So let me give you an example. Let me get my book. So anytime somebody comes up on a nursing test, or during their nursing test, or during their NCLEX test, this is what they do. They second guess themselves. That's a bad study habit.
I'm big with that.
That is a bad study habit. So how do we conquer this? It's easier said than done, but if you practice your solution that we're going to set today, then I believe that you can get it. So it says, do I second guess too much?
Yes,
Yes,
I do.
I do.
Okay.
I do.
Yeah, I do too.
My evaluation, that is, you don't trust yourself enough. Why? You went through the course, you passed the course, but you still don't know the information. You know it. You got to trust yourself, okay? And the way that you start trusting yourself is be confident in your answer choices. You have to be confident, okay? Repetition will make you consistent and confident, all right? If you see the same thing over and over and over, if you take the same route to work over and over and over again, you can probably do it in your sleep. Or you can probably do it with your eyes closed. Does that make sense?
Mm-hmm.
You have to be confident in your answer choices, okay? And the way you do that is you practice trusting yourself in your knowledge and your foundation that you got in your study. Okay. Procrastination. So my evaluation of that is you really just don't want to do it. Everybody who procrastinate, I just really don't want to do it. Like, I got 5 videos to make, but I just really don't want to do it. In my health assessment class, I procrastinated for 3 months, and then my end of term came up, and I had to do it. Like, I had to. Or I would have failed the class. So that deadline was coming up. So you have to set a deadline for yourself. Okay, you have to set a deadline and stick to it. Another bad study habit that people have. Am I reading the question too fast?
No.
I was reading the question too fast, and I was missing keywords that I needed to answer the question. It said 4, and I'm picking answer choices that have to do with after. Like post, if they say post-op, but I'm picking pre-op answer choices, that's a bad study habit. You need to slow down. That's the solution. Slow down. Okay. Practicing is the solution. Practice slowing down, and you can take the NCLEX people. You can take 2 minutes per question to identify keywords. 2 minutes per question. I know they drilled in your head. NCLEX 1 minute, 30 seconds. No, take your time. Read. And why I say this is because you're gonna have other questions where you just know the answer off the top of your head, and you can click it and move on, and that's gonna take you 16 to 30 seconds, right? That makes up for the other time that you have to spend on other questions. Now, I'm not saying spend 2 minutes on every single question. You have to pace yourself. Does that make sense? Pace yourself. Pace yourself on your questions. Okay? There's some questions you're just going to know. Some questions you're not going to know. You're going to have to reread it, take extra time, and then make a decision. All right? Another thing that everybody do when it comes to questions, it doesn't matter what question it is, adding too much information to the question.
Yep.
Okay. Do not say what if. There is no what if. Okay. You have to make you have to come to the conclusion by making inferences and by using your deductive reasoning. It's not a guess. Don't guess. What if? No. Don't do that. Evaluation is you just overthink. You overthink and it leads to false assumptions. Okay, that's a study habit that you have to avoid. Your solution, use critical thinking instead of adding what's not there. If it's not there, leave it alone. Leave it where it is. Leave it at the door. Stick to what you have in front of you, okay? And use your deductive reasoning. And what I mean by deductive reasoning is if a patient comes into your, if a doctor comes into your room, right? A doctor comes into your room and he don't wash his hands and he's getting ready to touch you. You can make an inference that it's still germs on his hand. Right? You know what I'm saying? Like, because he came in, opened the door, those are germs, right? Okay, but that's what you saw in front of you. But by him not washing his hands and you see him touching the door, that's an inference, and you can use your deductive critical thinking that he has germs on his hands. You didn't guess that. You didn't say, well, what if he got germs on? You know what I'm saying? Does that make sense to everyone? Use critical thinking your answer choice. Okay. Another bad study habit, writing out information and not going back to review it.
Yeah, I do that with note cards all the time.
Yes. If you in class, stop writing. Just write down minimal stuff. If she say this need to be on the test, start writing. But get a recorder. Your phones are recorders. Even if you cannot record it. Put the phone in your purse and record anyway. Okay? Just don't let them catch you.
Right.
But record it so you can go back to it. You can replay it over and over and over again so you don't have to take that PowerPoint. You can make up your own notes off of the recording. Okay? You don't have to write out rationales to questions. For what? They're already in the question bank. What you want to do is you want to create powerful notes. Create powerful notes that when you go back to them and you refresh your content or you refresh your notes, it's quick, simple, to the point. Okay? It's not rewriting everything the book just said or highlighting everything the book has to offer. No, you have to pick out what's important and what's not. So it says a lot of people that approach me, they say, I write out rationales or I write out information, from class. It helps me to remember. No, it doesn't. It gets stored in your short-term memory. That's memorizing. That's memorizing. You're not gonna know that stuff in 30 days unless you use, and here's the solution. Unless you use repetition and you go over them same notes every day for 30 days. You see the difference? If you're gonna write something out, you can't go back to it once or twice. It takes 30 days to make a habit. Whether it's good or bad, it takes 30 days to make a habit. Use repetition. If you're gonna go back to them same notes for, let's say you got a week. For the students, you got a week to remember all this stuff, right? Go ahead and write down your powerful note taking. You can use Pinterest. Grab a picture, put it in your notebook. That way you have a visual of it, okay? And then whatever powerful notes you make every day in the week, not just on that day or right before the test, every day in that week you need to review. That's the repetition. Okay, by the time the end of the week comes, you're gonna master it. Okay, hold on, let's see. I'm gonna try to mute everyone.
Yeah, it's better.
Okay. Okay. So, let's see. That's when you write in notes in class, and that is for you when you're studying in class. Please do not write rationales. They already there. You don't need to write them. The only time you would need to write a rationale to see if your critical thinking is matching it. If you was way off, then you need to write that down. You know what I'm saying? If you don't have a clue to what is going on, you don't have a clue. You didn't have a clue that a patient that was dehydrated and bleeding was going into shock, that's a problem. You know what I'm saying? Like, if you don't have a clue to what's going on or what's coming next. So again, to write out everything, repetition is the key to mastering core nursing content. You should be able to teach what you know to others. Okay, you should be able to teach what you know to others from your own head. The more you see it, the more you know it, right? So that's 30 days every day instead of, once a day, or instead of one or two times you've seen it and I got it. No, it's going to be in your short-term memory. It's going to leave. Okay. So, and then we're going to get into resources in a minute. So study habits, okay? On your brain dump study plan, you need to ask yourself, what am I doing wrong? Okay, write that down. Study habits, what am I doing wrong? If you're trying to figure out what you're doing wrong, here's how we're going to get to that. So, you have to ask yourself, what kind of learner am I? Okay, you need to know what kind of learner you are. Are you a visual learner? Are you an audio learner? Are you a hands-on learner? Right? A lot of people are going to say they're hands-on learning. They're hands-on learners. Okay? They have to do it in order for it to click inside their heads. Me, I'm a visual learner. My brain literally takes pictures of everything, and I can learn from a picture. Better than I can reading it, better than I can hearing it. Like, everybody was using those Mark K audios. That's great. But I couldn't get into it because it was an audio. I needed something visual. And hands-on, the way I learned to be hands-on, okay, So let's go through each of them, and I'm going to share my screen. So I want to unmute. So, and write this down. Let me see, hold on. I'm going to unmute one at a time, and I'm just going to ask you what you are or what you think you are. So, Crystal, what type of learner are you?
I think I'm a visual learner.
Okay, so write that down, please. Let me give you a technique. Let's see. Genesis, what type of learner are you?
I'm visual and auditory. I'm both.
Visual and auditory. Okay, so write that down, and I'm gonna write it down separately, and I'm gonna give you a technique for it. Gwendolyn.
I would say visual and auditory.
Visual and auditory. Okay, write it down separately. So I don't know if you could see. Yeah, I have a lot of notes on my thing. Jeff G, what kind of learner are you?
I'm a visual and a hands-on.
Visual and hands-on. Okay, write that down.
Mm-hmm.
Sandra, what type of learner are you?
I think I'm a visual and auditory.
Visual and auditory. Okay. So with that being said, all my visual learners, check this out. I'm going to share my screen. You can find, okay, so this is what I used to do when I was in nursing school. I used to go to YouTube. I didn't find videos where people were talking to me, because to me that's still audio. So I would find animated videos explaining pathophysiology to me, because reading pathophysiology is so boring. And the technique that I used was an animated video, 5 minutes or less, because I'm any longer in my I'm not ADD, but it's, I'm off somewhere else. So all my visual learners and auditory, this is what you want to look for. So this is Nucleus Medical Media, okay? And it's an animated video.
Type 1 diabetes is a condition in which your pancreas does not produce insulin, a hormone your body needs to maintain proper blood sugar levels. After you eat foods that contain carbohydrates, chemicals in your small intestine break them down into single sugar molecules called glucose. Next, the cells lining your small intestine absorb the glucose, which passes into the bloodstream. When the blood reaches your pancreas, beta cells inside the pancreas detect the rising glucose levels. The beta cells release insulin into your bloodstream to reduce glucose levels and to keep your blood glucose in a healthy range. Most cells of the body have certain receptors on their surface that bind to the circulating insulin. Insulin acts like a key in a lock to open up the cell so that the circulating glucose can get inside the cell.
So what she just gave you was normal patho. She gave you normal pathophysiology in 1 minute and 24 seconds. Do you see that? Do you see how powerful that is? She said, your pancreas is the organ for type 1 diabetes, right? Type 1. Your pancreas is the organ. So anytime I ask you, what's the organ that secretes insulin? Or what's the organ that, is associated with diabetes, you're automatically going to think pancreas now from now on because of this video. Okay? And she said, anytime sugar molecules rise in the bloodstream, right, which is represented by the purple. Your brain remembers colors, right? So you're going to remember on your test this purple rise in glucose in your bloodstream. Okay, anytime that glucose rises in your bloodstream, the pancreas detects it and secretes insulin. Okay, and insulin is like a key in a lock where it's going to grab the glucose and put it in the cell. That's all she just said in 1 minute and 24 seconds. Is that powerful or not? Okay, she just gave you normal pathophysiology. It wasn't boring. It didn't take that long. Like, if you could find an animated video on all your subjects before you read it in Saunders, do it. Okay, if you're using a Saunders book, please find an animated video and please look at it before you read it in Saunders. It's going to cut
Now
time.
your cell can use the glucose to produce the energy it needs to function properly. If you have type 1 diabetes, your pancreatic beta cells lose their ability to produce insulin, resulting in high blood glucose levels and other complications. In type 1 diabetes, your immune system, specifically your white blood cells, mistake your pancreatic beta cells for foreign invaders. In an autoimmune response, your white blood cells secrete autoantibodies that destroy your own beta cells. As a result, your pancreas produces little or no insulin. Without insulin, glucose cannot get into your cells, so they are starved for the calories they should be receiving from glucose. In addition, the glucose level builds up in your bloodstream, resulting in a condition called hyperglycemia. Common symptoms of hyperglycemia
Okay, so she just gave you the abnormal part. So now you got normal, and this is how I love to teach. Now she gave you the normal, she gave you the abnormal, now she's gonna give you the symptoms. I'm not saying the videos are all like this, but that's how you need to study. That's how you need to pull out the information. I need to know normally what happens with diabetes. I need to know normally what happens with the blood flow of the heart. I need to know normally what happens in healthy lungs, right? I just gave you respiratory, cardiac, and endocrine right there. The healthy pancreas, the healthy lungs, the healthy blood flow of the heart, right? I need to know what's happening normally so I can recognize the abnormal. And she just said that the beta cells don't work in the pancreas. Beta cells don't work. That's what's abnormal about type 1 diabetes. That's what makes it different from type 2 diabetes. The pancreas just doesn't work, okay? And so instead of grabbing the glucose now, the glucose is bouncing off of it. And now it's rising ever more in the bloodstream. And that was represented by all the purple, right? So you're going to remember that. You're going to remember that all that purple in that body was hyperglycemia. So now she's going to give you the symptoms. And we are 2 minutes and 40 seconds in. And you just got all that. You just got a whole lesson.
Type 1 diabetes include excessive hunger, excessive thirst, frequent urination, unexplained weight loss.
So the 3 Ps, they talk about that in Saunders, I think. Or if they don't, you can, your teacher is going to talk about it. Or you can remember from nursing school. The 3 Ps, polydipsia is what she just said, excessive thirst. Polyphagia, however you want to say it, excessive hunger. And I can't never remember urine. What's urine? Anybody? Polyuria. There you go. Thank you, Jeff G. Polyuria. Those are your 3 Ps And that's the hallmark sign of diabetes, of hyperglycemia, I mean. Those are your hallmark signs. So, NCLEX takers, when you get those hallmark signs in your questions, you should be automatically critically thinking diabetes, okay, hyperglycemia. And then it's up to you to identify what the question is specifically asking you, because that's just going to be your topic. You understand what I'm saying? So your topic could be hyperglycemia, but they want to know how you as the nurse going to treat it, or they want to know what medication can you give for this. You know what I'm saying? So the question is going to focus specifically on something that they want you to do before you call the doctor. Okay, so let's
Fatigue,
keep going.
weakness, irritability, and blurry vision. If hyperglycemia is not treated, you can become severely ill. Because you don't have enough insulin circulating in your blood, your cells can't use glucose for energy. As a result, your body breaks down your fat and protein stores as an alternative source of energy. As fat breakdown continues, certain byproducts, known as ketone bodies, accumulate in the blood, resulting in a condition called ketosis. When ketones build up to dangerously high levels, a life-threatening condition called diabetic ketoacidosis results.
So she gave you normal, she gave you abnormal, she gave you symptoms, and now she just gave you a potential complication of diabetes type 1. You see how that's moving along? How come y'all teachers can't do that? In 3 minutes and 46 seconds, y'all do not need to be in class 8 hours for this. Okay, like this blows my mind. This is why I'm going to be a teacher in education, because there's no way people should be failing at the rate that they are failing, because the information is here. And it's just the way that they teach it as to why people not getting it. So she gave you normal, abnormal, she gave you signs and symptoms, and she gave you a potential complication. So what's a potential complication of diabetes type 1? DKA. I got a whole case study in my group just on DKA. Just what you do as a nurse, the patho that you're pulling out, the risk factors, the labs and diagnostic tests, what you're going to do as a nurse, how you're going to position the patient, what medication do you anticipate the doctor ordering, what are you going to do if they have to go to surgery. Like, this is core nursing content in 3 minutes and 46 seconds, and we're not even done. And we're not going to get into ketoacidosis today, but that, just know it is a potential complication, because that goes into critical care. Now you have a medical emergency. That's how NCLEX is going to test you, okay, on those different areas of just that diabetic, type 1. They either going to give you the medical emergency, they either going to give you, ask you about signs and symptoms, they either going to ask you about abnormal patho. They can ask you about anything. It's up to you to know the flow of it. Does that make sense? It's the same thing for all subjects.
Mm-hmm.
Let me say that again. It's the same thing for all subjects. So asthma has a flow, normal, abnormal, potential complications, and signs and symptoms and potential complications. Cardiac has a flow. You need to know what the cardiac output is doing, okay? Pneumonia has a flow, okay? Normal, abnormal. So that's the constant that I need you guys to understand when you're studying. That's the important thing you need to be pulling out. Normal, abnormal, signs and symptoms, potential complications, and your nursing interventions. You need to be correcting all this abnormal stuff. And you have to partner with the doctor and anticipate what he's going to do. Okay? The two of you are a team. The doctor is not above you. Yes, he has more schooling, great. But if he makes a mistake and you administer it, guess what? You're thrown under the bus. That's why I say study to save a life. Because if somebody comes in with diabetes type 1, okay, and let's say the doctor not prescribing them no insulin, or the doctor's trying to prescribe them an anti-diabetic oral medication. Do they need that? Is it going to work for them? It's up to you, the nurse, to catch that. That's why I say you and the doctor work as a team. So you have to know the process and what's going on inside the body in order to catch certain things like that. If you don't know that an oral diabetic medication has nothing to do with insulin, but how it works metabolically in the body, you're going to give that oral medication and your patient is going to be in DKA. And now you in a medical emergency. Okay? So it's up to you to learn and this is the constant for med surg, guys. Normal. Okay, you need to know the patho. You need to know normal patho. And then what happens in abnormal patho, the risk factors, they just throw that in. Risk factors, oh, she's a smoker, she's obese, okay? That's a risk factor. And then potential complications. Potential complications are your medical emergencies, and that NCLEX will test you on that too, and your teachers, okay? Your exit exams too. So learn the flow of how to study. This is what you're here for today. You're learning the flow of how to study. Normal patho, abnormal patho, signs and symptoms, potential complications, and your interventions to correct all of these things. Okay? So we're going to move on. So this is visually, guys. This is visually. You just learn this visually in 3 minutes and 40 seconds. And then audio learners, you could play this in your car while you're driving. You don't necessarily have to. After seeing it once, okay, you know what it looks like. You could play it again. The Mark K audios. If you have access to them, great. If you don't worry about it. Play whatever you have access to. Use your resources. If you got, Rachel Allen or whatever, you was able to record your teachers. Play it back when you're driving in your car. Play it back when you're cleaning up your house. All that repetition is going to go into your long-term memory. It's that repetition of audio that like embeds it in your head. Because when you're on your test and you see a certain keyword, you're going to be like, oh, wait a minute, I heard that when I was washing dishes and I cut my finger. Or I heard that when I was in the kitchen doing XYZ. Okay? You have to relate your learning to something. And hands-on, the hands-on learners, okay? Please, 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 once you learn health head-to-toe assessment, please start assessing everybody you come in contact with. Let me say that again. If you've been out of school for a long time and you trying to take NCLEX, start assessing everyone you come in contact with, okay? And I said this on my little freebie video, but I don't think people was picking up what I was putting down because let's say you go to a family barbecue, right? And, Genesis, you raise your hand, you got a question?
I did have a question.
Okay.
So the keto, the DKA, is that when they have sweet breath? That's all I wanted to know because I didn't hear it in the video.
Mm-hmm. Yep.
Is that it?
Yep.
Okay, that's what I wanted to know.
It's the ketones. Yep.
Okay.
Yep. Okay.
Thank you.
You're welcome. Okay, so hands-on learners. You go to a barbecue, right? You see Uncle Johnny. Uncle Johnny is fine, okay? Let's say fast forward to Thanksgiving. You see him again. He has no hair on his legs. They're swollen, +2 pitting edema, and he's smoking a cigarette. And he's complaining of calf pain. Something changed, right? And you noticed it. Why do you have pitting edema? First of all, Why do you have, somebody's calling me late. Why do you have pitting edema? Why are you complaining of calf pain? That's when you should start going into critical thinking mode. Well, how long has he had this edema? Because the last time I saw him, he didn't have it, right? Well, how long have you had calf pain? And does it hurt when you walk? Does it get better when you stop walking? Those are the things that you should be assessing on everybody. You could be going to a grocery store. It don't even have to be a relative, right? You could see them like pushing a cart, double over, and shuffling their feet. That's automatic. Inspection is the number one thing, assessment tool that will give you more insight into a person's diet. Okay, if you see them and their teeth are nasty and they breath stink and you know they're not brushing their teeth. Diet, hygiene, okay. Mobility, the person that's doubled over the car and shuffling their feet, but they still trying to grocery shop. Okay, they don't have mobility like they should have. Okay, Genesis, you got another question? No? Okay. So that's how you hands-on learn. Even if you don't get it from clinicals, it's okay. Start assessing everybody, your friends, your family, babies, people in the grocery store, people at the car wash. Like, you can tell when somebody, like, okay, this person on this real estate show, right? Him and his wife, they were realtors, and they had a HGTV real estate show. And he was talking, and during his interactions, a nurse was watching the show, called in and said, he has a goiter. He has a goiter. Do you guys know what goiter is from? Does anybody not know what the goiter is from? Okay.
I don't know what that is.
Okay. So, Jep, you want to tell them what it is?
It's iodine deficiency.
It's what?
Goiter is from iodine deficiency.
Okay.
It's also a complication of the hypothyroidism.
Hypothyroidism. He had a goiter. He had hypothyroidism. He didn't know it, and she saved his life because he went and got it. Went and got his thyroid removed, and he no longer had a goiter. She called in. A nurse was assessing him. Yeah. From the comfort of her home. Called into HGTV like, he has a goiter. You might want to let him know. Okay, he didn't know what was wrong with him. He said he had been feeling, he had all the symptoms of hyperthyroidism, right? And she just called in, and he ended up having hyperthyroidism. He didn't know. Doctors, I mean, he hadn't gone to the doctors. You know, men don't like to go to the doctor. But she ended up saving his life just from assessing him from the home comfort, like laid back watching a TV show. Okay. Hands-on learners also. So, did you guys write that down? Have y'all been writing down stuff? Okay, so visual learners, YouTube animated videos. Okay, we learned all that stuff in 3 minutes and 46 seconds. Audio learners, please drive with the information on in your car. You got audio box cords, you got Bluetooth or USB cords. Plug that stuff in and play it while you're driving. Okay, if you got a 45-minute drive, you can learn a lot in 45 minutes. Hands-on learners, start assessing everybody you come in contact with. You know when your kids don't feel good. Okay, you know when you don't feel good. You know when your family is not right. What else? And I was gonna say something else about visual learners. I don't know, I forgot. Oh, TV shows. The best TV show you can learn from, House MD, because it's kind of funny and vulgar. And Grey's Anatomy, honey. When I tell you, I was sitting in my living room, and I think we had a test coming up on musculoskeletal. And they had a patient, and if you watch Grey's Anatomy religiously, they had a patient that came in. He was stuck in cement. And I thought that was so like crazy, like, oh my God. So they had to go through the process of getting him out of this cement. And they was racing, even though it's a doctor's show, you can still relate it to nurses. It's the same information. And you can compare it to see what's wrong, what they got right and what they got wrong. So they was racing against the clock to get this boy out of cement. He thought it was a good idea to go to a construction site with his girlfriend and jump in the cement, and then he got stuck. Duh. So they was racing against the time, and they had like 40 minutes, and the fire department was there, and they was like sawing him out, and they had all these tools or whatever. And Bailey is the one where they was like, wait a minute, we're hydrating him. He hasn't peed in 4 hours, okay? And we give him all this fluid, and he has this pressure injury. Pressure injuries lead to compression. What is it? Compression syndrome? Compartment syndrome.
Compartment. Yeah.
Compartment syndrome.
Compartment. Yeah.
And they was racing against the clock so that he would not have compartment syndrome. And they got down, I think they got down to like the last 30 minutes, and they finally got him out of this the cement, and his leg was as big as, you know, whatever the compartment syndrome symptoms was, he had it. And then the bone doctor, the ortho doctor, whatever, she gave him a what? What's the treatment for compression? Compartment syndrome.
Rice.
No, not rice. It's compartment syndrome. So rice is for sprained ankle.
Fracture. Oh, sorry. Yeah.
So compartment syndrome is a fasciotomy. A fasciotomy where she had to cut his leg open to relieve the pressure.
Oh, wow.
That was a test question on my nursing exam.
Mm.
And because I visually watched that show, and they was racing against the clock, and they took the cement away, and his leg looked like that, I had a visual now. And when I took my test, and they had them symptoms, I was critically thinking about compartment syndrome based off of what I saw, and I knew the answer was a fasciotomy because she had to cut open his leg. Now, I bet you if you go to Saunders right now, it's in there. And it comes to life. Those TV shows, if you could find a medical show to watch, that's why I liked it, Cold Black. Cold Black is down to a T. They canceled it. But Cold Black, they had people coming in with cystic fibrosis, and she touched his skin and licked her finger, and she was like, he's salty. Like, just that weirdness that she did, right? I see your face, Chris, like, oh, that's weird. But she was describing cystic fibrosis. He couldn't breathe. She listened to his lungs, and then she palpated his stomach, and his breathing was getting worse. And it was just the visual and the audio and everything going on with that helped me tremendously to remember those two things, compartment syndrome and the treatment. Even though, yes, it's a doctor's show, and you're going to find nurses be like, oh, that's a doctor's show, and yeah, doctors are really going to be helping their patients like that, and blah, blah, blah. Okay, forget all that for just 2 seconds. Focus on what they're doing in the show. Just like, one more example, and we're going to move on.
There's also one show, The Good Doctor.
The Good Doctor?
It's really good.
Okay. So learn from it. Learn what they doing wrong.
I'm guessing you can get my text message.
Learn what they doing wrong. Okay. What else? Let's see. And then one more example. I think I was watching Cold Black again, and it was a nurse. He was the head nurse. He was the charge nurse. He running around for everybody else, making sure they okay in the ER, right? Okay, fine. He goes to the storeroom, drop and have a heart attack. Okay? No, I take that back. He was in V-Field. He was in V-Field. In the storeroom, by himself. Okay? The head charge nurse. And I'm like, oh my God, who gonna come find him? Because he was like there for a long time. And when they finally found him, they were like, we're gonna have to, no, I take that back. He wasn't in V-Field, he was in SVT. He had like an SVT rhythm or something like that. And they had to give him amiodarone. And it hurt like hell. And they was like, it's gonna stop your heart in order for it to give, the jump start to a good rhythm. And they was like, are you ready? And it was so intense. Okay, it was so intense because I'm like, wait a minute, he's still alive. Why are they stopping his heart? But the medication did it. And that's what it does in real life. That's what it does in real life. So for you to like have that connection with these visual programs, please find videos on YouTube, TV shows to watch to make your connection and take your notes. Does that make sense? That's how you bring your content to life. You don't got to sit and read Saunders word for word. Some people be like, I read Saunders from cover to cover. Why? Go in, get what you need, set it aside. That's how you need to do Saunders. Oh, this book is too big. So what? The Bible's too big too. You gonna complain about reading that? And I know not everybody reads the Bible, but I'm just saying, recipe books are big too. You gonna sit and read the recipe book from cover to cover? No. You get what you need, make the recipe, and you put it back. And you do that however many times you need to. Okay, so that is how, in a nutshell, you create solutions for your study habits. Okay, I hope that was helpful. And please watch this video again because I'm all animated and stuff. Okay, so let's move on to resources. On your brain dump study plan, your resources, you need to ask yourself and write this down. Am I using them correctly? Am I using them correctly? Saunders tries to be a all-in-one package, okay? They have content, they have questions. When you start to build your foundation in your nursing program, and you start to build your foundation throughout and you pass, those questions will start to get easier and easier and easier. It doesn't mean that you don't know the material. It just means that you got a foundation now. You know the information. You need something a little bit challenging, okay? That's when you move on to like Kaplan questions. Kaplan questions are going to challenge you because they're trying to get you to implement their strategies, okay? Kaplan, okay, so let's go back. Hurst and Saunders will give you all the content you need. If you can go to a Hurst review class, okay, Hurst gives you the meat and potatoes that you need for these specific subjects, okay? Yes, it's a class where you have to sit and listen to somebody talk and take notes. But the thing about it is you have to practice those notes afterwards, okay? So if you go to Rachel Allen, it's the same thing. They're going to give you content. It's up to you to practice the content that they give you, okay? If you're going to sit there and write notes from a review class, make it interesting. Color code your notes. Your brain remembers colors, right? Okay. You're going to remember if I posted a picture of a lady that was a white lady and she was straining on the toilet. Did y'all see that in my group? Do y'all remember seeing that? The white lady, she was just straining with her pants down around her ankles. Y'all gonna remember that. And I asked the question, if she's straining so hard, what could happen to her? You're gonna remember that. Find pictures on Pinterest and post them to your notes, whatever notes that you have from your review class. If they talking about a laxative, get poop emojis and put them in your notes. Like, I mean, just make it interesting, okay? That's all I'm trying to say. But Hurst and Saunders is for content. Kaplan is for strategies. Those questions are based on NCLEX categories. And NCLEX categories is the same as the Saunders book. It's just in a different format, okay? So Kaplan is a little bit more, I should say, comprehensive. So if you want to start doing comprehensive after you've gotten your solid content foundation, then yes, by all means, do comprehensive questions. But don't start off doing comprehensive questions if you don't have a clue to what's going on. If you don't have a clue to patho, your interventions, none of that. Study by systems. And Saunders and Hurst helps you to study by systems. So write this down. Saunders and Hurst, they help you study by subject, nursing content subjects. So fundamentals, so that means they have a whole category on fundamentals. They have a whole category on respiratory, on med-surg. They have a whole category on mental health, pediatrics, maternity. Okay, those are your subjects. Marquee. If you have access to the Marquee, I'm not saying that I mean, that's bad. Don't be sharing it. If you happen to go to his class in Ohio, that's great. He's tips and tricks. You have to have a foundational content. You have to have content. All right? Don't get caught up in everybody saying, I pass with this, I pass with that, I pass with this. First of all, I just showed you what type of learner you were, or you just told me what type of learner you were, and I just showed you how to get your information. So, Marquee, you're sitting there like a review class, in class, and you're writing down his notes with his books that he do, but it's tips and tricks. It's tips and tricks for remembering the information. So let me give you an example. He said ABGs, right? ABGs, in order to know if a person is, if a person is hyperventilating, you think overventilating. Hyperventilating, just think overventilating. Is this action, reword it, ask yourself, is this person overventilating or underventilating? Underventilating is hypoventilation, okay? When a person hyperventilates, what's happening? Does anybody know what happens in the body when a person hyperventilates? What are they holding on to? What are they releasing too much of?
Isn't it something with the gas exchange?
Mm-hmm. Yep, absolutely. So hyperventilation, they breathe in really shallow, right? Okay. And they're holding on to too much carbon dioxide. Holding on to way too much carbon dioxide. Okay. When you hypoventilate, you are blowing off too much carbon dioxide. How do we get it back? What do they tell you to do for hypoventilation? It's underventilating. You're not getting enough oxygen. That's how you critically think through that. Underventilating, you need oxygen. Overventilating, wait, I'm sorry, I'm getting confused. Hypoventilation, hypo, okay? I think you're blowing off too much carbon dioxide. That's when they tell you to go breathe in a paper bag. You get it? If you're blowing off too much carbon dioxide, okay, and you're retaining too much oxygen, you're going to need to blow off some of that oxygen. So the paper bag creates a seal and it comes right back. Okay, the carbon dioxide can come right back real fast. Okay, if you're hyperventilating, you're blowing off too much oxygen. It's the opposite. You're blowing off too much oxygen and you're keeping too much carbon dioxide. So that's why you get a non-rebreather mask, because that rebreather mask traps the CO2 and gives you more oxygen. So when you overventilate, you need oxygen. When you hypoventilate, you need the brown paper bag. Okay? Go find a picture of a brown paper bag and put it next to underventilating. That's how you can remember it on your test. Be creative when you're making your notes. So back to the resources. Hurst and Saunders, I said, helps you study by nursing content subjects. Kaplan and Marquet, they are tips and tips and tricks. They want you. Marquet has great strategies. Okay, that prioritization, acute versus chronic, and Kaplan too. I like Kaplan strategies. You just got to know how to, like, the decision tree don't work, but if you take the bolded keywords that they have and you put a definition to it, which is what I did, which is what I provide for free for everyone. I give everyone free test taking strategies. Okay, it's in my group. It's like the first announcement that you see. You download it, you learn what they are, and you practice them. Okay, Kaplan and Marquet is tips, tricks, and strategy. Okay, as Marquet has good prioritization strategies in the Charity book, but I had to stop using them because they had like a lot of wrong information. UWorld is a question bank. It's a very good question bank. You will see a lot of people passing with UWorld, but a lot of people also fail with UWorld because they think, oh, I can only use this. I don't got to refresh my content because I'll learn content from rationales. And then they end up failing because they don't hone in or focus on their weak areas. And that's our number one thing. That is our number one thing on our list today is weak areas. Nobody thinks about their weak areas. NCLEX will hammer you with your weak areas if you do not refresh them. Let me say that again. On my test, my first time, I was weak in psych and mental health. And I messed up. And I swear to God, that's all they gave me. And I was so stuck. And like, I had no clue what was going on in the questions. Like, I had no clue because I didn't refresh it. My second time, right? I refreshed my weak areas. I was weak in cardiac, musculoskeletal, and endocrine. Okay. And I refreshed the other things that I needed to refresh, which was pediatrics, maternity. Okay. So what I did was, second test, I was more confident. I messed up on a cardiac question. Well, first they gave me a dosage calculation. I passed it. I didn't get no more dosage calculation questions, okay? So that tells me right there that I got it right. I messed up on a cardiac question, okay? Do you know they hammered me with everything cardiac? I had cardiac tamponade. I had cardiac endocarditis. I had cardiac in my myo and cardio infarction. They asked me about cardiogenic shock. They asked me about everything cardiac. They asked me about arrhythmias. What rhythm would you see with a person with hyperkalemia? And I'm like, what? Everything. They hammered me. I messed up on one question on cardiac, but little did they know I had just studied cardiac. I had just refreshed my cardiac. And so even though I messed up on one question and they kept giving me the cardiac questions, and it wasn't in a row, they would give me a priority question, then a cardiac question. They would give me like a diabetic question or a lab question and then a cardiac. They thought they was slick. But because I was consistently answering my cardiac questions correctly after that, that's when they started coming with the select all of the class, select all of the class. So I had 27 of them, not in a row, and I was ready for them because of the strategies, okay? I had got strategies down pat so good to the point where my critical thinking was matching up with the rationales while I was at home. If you can do it at home, you can do it on your test. You just got to be confident. And then we discussed that earlier. That's a bad study habit. Turn it into a good one. Be confident in your answer choices. For nursing school tests, exit exams, and NCLEX. Okay, so UWorld. It's a question bank And the reason why I said this earlier, the reason why we answer questions is to make sure our critical thinking is matching the rationales, okay? So it's okay to get questions wrong on NCLEX. Do not let a person tell you that you're not supposed to get anything wrong. They know you're going to get stuff wrong. But they want you to consistently get stuff right in a row, no matter what question is given to you, versus the wrong. That's how you get near passing, because it's an imaginary line that they have, and you just ride in that imaginary line. You just ride it. You don't boost above, you don't go below. You just ride it, okay? That is all near passing. Does that make sense? When you get all near passing, that means in certain categories, whenever they gave you that question, that you was just riding that line. You never boosted above, you never went below. When you have below categories, that means you was going up, but then you just tanked and you stayed down. That's getting like a lot of questions wrong in a row. That's below passing. So whenever you see a person post they results and they say, well, I got below passing and this, and this, that's because they was on that line, the imaginary line, but then they got something wrong and they just plateaued on the bottom. Okay? When you see people that have above passing, that means in that category, they just kept going up and up and up and kept getting correct consistently in a row. And I'm not saying consistently like, I'm saying consistently in a row. That means 5 and 6 questions in a row versus 2 wrong. Okay, another 6 in a row correct versus 3 wrong. Or you could do 1 when you ride the line. No, when you go below, it's because you go 2 right, 2 wrong, 3 right, 2 wrong. You still below that line. You don't never catch up. 5 right, 5 wrong. Okay, you still back at net as to the amount of questions that you're getting wrong versus correct. So the solution to that is you got to get your strategies down pat, because strategies help you when your content knowledge cannot. Students, start learning strategies while you are in school. Okay, they will help you. All right. So it's never too late to learn test taking strategies and start practicing them. And you want to make sure your critical thinking matches questions, rationales. Like I said before, it's okay to get questions wrong on NCLEX, but while you are at home studying those questions, it's okay to get them wrong. But the difference is, did you get part of the question wrong? Did you know the answer, but you got one part of it wrong? Or did you like get the whole thing on? You was way off. Okay, you supposed to be picking out signs and symptoms to pneumonia, but you picking out signs and symptoms to tuberculosis. They totally different. Totally different. Okay. And then, so UWorld is a good question bank. In the beginning, once you started, please study by subjects to get that subject down pat. All right. You have to, I'm telling you, if you get these subjects down packed, by the time you get to NCLEX, you're just going to know that stuff. You're going to know it. You're going to be able to teach it to whoever want to listen. And then once you pass NCLEX, you're going to be able to teach it to your patients. I had a very hard time. Well, I didn't have a hard time. Yes, I did. I had a hard time because we learn all this stuff, medical terminology, all this stuff, just to go back and teach our patients in layman's terms. Okay? So you got to know what's going on in order to teach them in layman's terms, because I had a 20-year-old patient, and she came in to deliver a baby, and she was like, oh, what's an epidural? Oh, if you put that Foley catheter in, how the baby gonna come out? And I'm like, that's a separate hole. Like, she didn't know basic anatomy. So I had to go back, back to the basics. So you're gonna have to go back to the basics with your patient, okay? So you have to learn how to educate. So please find a study buddy and bounce your knowledge off of each other. Okay, and don't be afraid to say, well, no, this is wrong because, and it's right here on page whatever. My teachers used to hate me because I was like, on page 98 it said, and they knew, and my classmates knew whenever I raised my hand that I was gonna get us extra points because I found it on page whatever, and she would have to go back and review it, and I'm like, oh, okay, yeah, that was wrong. The test was wrong. I'm gonna give y'all 2 points because I was able to know my content and bounce it off of somebody else and find it and back myself up and find it in a book. Sometimes you got to do that with doctors too, but that's for another day. Okay, the last thing, REMAR. REMAR is good for content, but it's basic content. It's like medical terminology content. Okay, it's not the specifics of breaking down endings, but she's very, 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 very broad, very basic, very superficial. Okay, she's not going over patho like Hurst. She's not going over, it really don't take any, I should say, critical thinking to go through her program. Even though it's the same information, she's giving you basic stuff, signs and symptoms, intervention, what this gonna look like. But I'm asking you to recognize different things a little bit deeper than superficially studying. So what I mean by that is you got to know what we just looked at in that video, the normal patho, the abnormal, the signs and symptoms, okay? You got to relate. NCLEX wants you to relate your signs and symptoms to your lab tests, to your vital signs. You got to relate all of them, okay? If somebody comes back, somebody has you put the post-ox on, and their post-ox number is reading 89, right? Okay. NCLEX will give it to you as, what ABG imbalance is this? Is it metabolic? Is it respiratory? Is it respiratory acidosis? You know what I'm saying? And then you're going to have to decipher from that. You're going to have to critically think through that question. Okay? So that's what the NCLEX category is for reduction in risk potential. They want you to relate your vital signs and your labs relate them together so that you can reduce the harm. Post-ox, you put it on, it's 89. Okay, they asking you about ABGs now. You're like, what do an ABG got to do with post-ox? It's still oxygenation through the body. The post-ox is capillary. The ABGs is arterial. ABGs is more accurate. So the lab test. So the lab's going to come, draw the blood, spin it, and then call you with the critical lab value of, oh, this person's pH is 6.1. Okay, now you got to think, oh, damn. 6.1, that's acidotic. You got to call the doctor with the results, right? And then he going to say, I'm coming up there to intubate. Prepare me for intubation. Then you got to go get the stuff, right? That's how it flows. I'm asking you to learn how patient interaction flows, okay? When you studying, it's not just picking out. If you want to know what's important to pick out of the Saunders book, that's what you pick out. Normal patho, normal patho, abnormal, signs and symptoms, and your nursing intervention, okay? If a patient has an 89 post-ox, your intervention before you call that doctor, how you gonna position that patient? You gonna lay him flat and he can't breathe? No. Well, how you gonna, a person can't breathe? You can see a person not being able to breathe. You don't even gotta listen. And if you listen and confirm that he got like diminished lung sounds, which means there's air in there. Okay, diminished lung sounds means air, and crackles means fluid, right?
Mm-hmm.
Okay, you can inspection. You can see him. He got shortness of breath. You see the pulse ox is 89. You listen, and it's diminished. Okay, those are the things that you need to be putting together. Okay, and then so I'm asking you guys to use the Saunders book because you can learn it. Saunders breaks it down in a way. It's a list. Yes, it's a list. But it breaks it down in a way where the list will flow. And your interventions are telling you why the patient is coming with these symptoms and what you need to do. What you need to do, the why behind your interventions and why you're doing them. Okay? The patient can't breathe. The symptom is shortness of breath. Pulse ox is this. They can't breathe. Your intervention, sit them up. Why? Because it expands the lungs. That's what you're getting out of Saunders. Okay? So I'm not really sure if Remar does all that. I think it's just I think it's more superficial studying, like, okay, pneumonia, bacterial infection, signs and symptoms are this, interventions do this, period. And there's no real critical thinking to that. It's just like nursing school again. Sandra, you shaking your head, yes. Did you do Remar before? Can you tell us about your experience?
No, I was saying, like, I said, how come people say they pass NCLEX only with Remar? Because I'm doing Remar now. But I don't see, like, anything like, oh my goodness. It's not deep.
It's not.
You know,
It's not. I'm telling you, it's basic.
It's like it's basic content. Yeah, you're right.
It's basic. It does not have a critical thinking component to it. That's why I'm giving you guys my 19 case studies. Because that case study, when I tell you it's going to pull out everything, you're going to be like, I never thought to think that lab diagnostic test went with this disease, or my intervention was supposed to do this, or...
It doesn't go like that.
Yeah. No, I want
Marquet goes like he goes over everything, like the lab value, and make you like know how to recognize that what is what.
Okay. Yeah. So I'm telling you, you are with Marquet, you already have to know something. You can't go in thinking that I'm gonna refresh all my content with Marquet. No. You have to know something. And with Remar, it's like, yeah, if you want to refresh, you've been out of school, let's say you've been out of school for 10 years and you're going to try to go to NCLEX, fine, take Remar because it's basic. You're going to learn basic stuff. But you're going to have to maybe pair it with Saunders, but I don't know how because all her stuff is random. So, like, she could be on growth and development and then be talking about maternity the next thing, and you're like, what? You're not going to be able to relate it. Whereas if you study the system of respiratory, you're going to be able to do asthma interventions, okay? You're going to be able to know tuberculosis interventions. You're going to be able to know COPD interventions. And the whole theme of respiratory system or subject for you as the nurse, okay? When you do my case studies, you're the nurse. Not her over there, not your buddy next to you. You're the nurse. So you're going to have to ask yourself, what do I need to do if this person was in front of me? Okay? So you're gonna pick up that theme of respiratory, like, dang, I need to prevent respiratory distress or failure. When I see distress, I need to prevent respiratory failure. What does that look like? What does respiratory failure look like? The patient has no respirations. That's respiratory failure. Okay, you gotta think about what's going on. If the patient's ABG comes back as 6 whatever, that's death. They are near death. They need an airway. They need to breathe. Intubation. The ventilator does that for them. Okay? That's how deep you need to be thinking. You need to be able to put everything together for your patient, you as the nurse, from admission to discharge, recognizing normal, abnormal, signs and symptoms. Okay, what I'm going to do about it. Okay, what the doctor going to do about it. Because if the doctor mess up, you got to catch it. Okay, so next things next. We are on to strategies. I know I'm going over. I'm sorry. Okay, so let's, is this helping anybody? I just want to know. Is this like, how, I just need to know so far, what do you think? Unmute everybody one at a time. Crystal?
I didn't even hear what you said, Rita. What was your question?
So I'm saying, like, so far, are you learning anything? Like, what's your
Yes, I'm definitely learning how to break things down, and some of the things that I didn't realize was a problem with my study habits, you bring them up. So
Okay, good. All right. Genesis, what about you?
You know, we were talking about like the videos in the past though, and I feel like reading in the book, I do get bored. I get overwhelmed.
Mm-hmm.
So now, like watching the videos and letting them break it down, I think that works better for me.
Okay. All right. So y'all gotta remember this, because I'm gonna need y'all to go in a group and say these things again. Just to let people know, because I don't really think people know. I think they just feel like, oh, she's just trying to get money from us. That's not it at all. I love to educate, okay, and I love to help others. And y'all can see it in me, genuinely. Like, I'm breaking stuff down as we go along. It's not just me sitting here monologuing and y'all taking notes. Like, I think that's what people think this is, but no, it's an experience for you. I'm putting you on spot. Like, I love to put people on spot too. Okay, so Gwendolyn, what is your experience so far?
I have learned a whole lot so far. Like the other young lady was saying, I didn't realize that it was so much to taking notes as far as if you know the normal, you'll be able to recognize what the abnormal is, and the risk factors and the complications. And if you know that stuff, it doesn't matter what version of her test or what kind of test they give, you'll be able to pull it out.
Yes.
If you know the basic concepts of it.
Yep. And these are the techniques that you need to practice over and over again. Doesn't matter the subject, doesn't matter, it doesn't matter. Repetition, and just this is how you study. This is how you pull out the things that you need to know, instead of just highlighting everything. Okay. I was in school one time, and I was in med-surg class, and the teacher, I said something about teaching us critical thinking. She said, you can't teach critical thinking. It's just something that you have to learn. I was like, I can teach critical thinking. But I didn't say that to her. But I proved her wrong, because I started tutoring all my classmates. That's how this company came about, because I was tutoring all of my classmates, and some of them were passing. Okay, people that was in the like gutter were starting to come up, and she was like, and I guess they recognized that, because at graduation I got the leadership award at graduation, because they recognized me tutoring everybody, and people started passing. And they was like, oh my God, I wanted to be, they locked us out of clinicals. Okay, teachers wasn't showing up to clinicals. They locked us out of the simulation lab. We had one simulation the whole entire 2 years that we had to go through, okay? We didn't get to practice with the mannequins all the time, okay? They didn't give us case studies, okay? They just blew content to us, and we had to self-study. But I had failed nursing school again, so I didn't care what they gave us. The best thing they gave me was that Saunders book, because I didn't have it the first time I went to nursing school, and I failed miserably. And people had test banks and all that stuff. Nobody told me about none of that stuff, okay? I was mad too. Like, wait a minute, you was passing pharmacology and I was failing, and you had a whole test bank? No.
I went through that too.
Girl, but anyway, so I've been through everything you guys have been through. Failing NCLEX, I failed it. Failing classes, I've done it. Getting kicked out, having to reapply again, I've done all of that. All of it. And that's when I said, never again will I ever have to go through this, okay? I made that case study checklist that I'm about to give you. I made that up myself. And then I discovered that another company like has the same kind of application thing, but I don't think they like promoting it as well as they should be, because that checklist is bomb.com, and it takes your patient from admission to discharge. And all I need you guys to do when you get it is think like a nurse. You already are nurses. Let me say that again. You're already nurses because you have the compassion to help others, okay? Because you're sacrificing yourself going through this program that don't nobody care about if you pass or not, and they just, throwing content at you. The NCLEX don't care. I feel like NCLEX is a scam only because the school don't help you. They keep taking your money. Okay, they keep telling you go to these remediation courses. They're not regulating the remediation courses. They're not. So I feel like it's a lot of NCLEX graduates that are left out here on their own. Out here on their own. And then you got people, I'm not gonna say no names, but then you got people that's $500 NCLEX review, $1,000 NCLEX review, and it's like, for what? My NCLEX review gonna be $500, but it's gonna pack a punch. Okay, you're gonna be leaving there like, if you think this is good, wait till my students, y'all wait till y'all get to NCLEX. But I did do the NCLEX boot camp for 4 months, and I just laid every technique out because that's what you need. Like, you got the content already. You need the technique, the approach, the how to do anything, how to do strategies, how to do, whatever. Okay, so, all right. Crystal, you have a question?
Did you say that the NCLEX is going to change for 2019 to fill in the blank?
They're going to have multiple choice, fill in the blank case studies. But you ready because you got my case studies, so it doesn't even matter.
We'll see.
I know that's right.
So take that we'll see, throw it in the trash. I need you to get confident.
I hate filling the blank.
But it's okay because you're going to have to fill in them case studies. They fill in the blank.
Yeah.
You got to fill in everything. And it's okay. That's how I passed my second time, by filling in the blank to that checklist that I made for myself and a strategy. Okay, so what's your experience so far?
I'm feeling so positive right now.
Huh?
Yeah, I'm feeling so good and positive, optimistic right now.
Good. So I'm giving you your confidence back. That's good.
Yeah, because I'm somehow I'm good at content, but I'm not good on strategies.
Okay.
So I will apply that in the questions.
Okay.
Yeah.
Okay. So let's do. Okay. I did everybody, right? I think I did everybody. Okay. So the next thing is test taking strategies. It is never too late to learn test taking strategies, you guys. Okay? Never. And if you are approaching NCLEX now, that's fine. Learn it now. Okay? And there's a specific way that you need to learn it. Now, I'm going to say this. You don't have to use my strategies. I'm not saying they're the best in the world, but I think my strategies go a little bit more in depth as to the bolded keywords, as does as Marquez does too. He's very good with prioritization, okay? And Kaplan as well, with the acute versus chronic and all of that stuff. I give away strategies for free to everyone, okay? I'm not the only one with the same strategies. NCLEX Mastery has strategies. Brilliant Nurse has like 100 lists of strategies to use. But the technique, I also give you the technique. So you can get the strategies from wherever, but learn how to use them. So write this down. So, okay, for strategies, it says, do I really know what they are, and am I implementing them every time I do questions? So there's a technique that you do for every question, okay? I'm pretty sure you're going to hear this 1,000 times, but it's really going to click when you have to do it yourself. So you read the question, right? You figure out your subject, all right? Figure out what they talking about. What they talking about is not necessarily what they asking you to do. Let me say that again. Even for your nursing school test, find your subject. Whatever your subject is whatever the question, whatever your subject is, it's not necessarily what they're asking you to do. Let me give you an example. So on my NCLEX, my second time, they gave me a question and they said, this patient is in heart failure. Okay, the patient was in heart failure. Here's a list of foods. Figure out which ones, basically can this patient have. No, it went like this. This patient is your patient in heart failure asks you, nurse, what can I eat today? Just like that. Short, to the point, vague. Let me say that. Let me say that question again. They said, your patient in heart failure asks you, the nurse, what can I eat today? And then they gave me a list of foods, right? And I had to pick from the list of food. So if I didn't know my heart failure diet, or if I didn't know the expected outcome of a heart failure patient, I would have got it wrong. Okay? Use expected outcome to answer your question. All right? So 3 things, 3 main strategies, and I'm going to give them to you right now. So number 1, use expected outcome to answer your questions. Okay? Use expected outcome. Number 2, use the process of elimination first before you go trying to choose an answer choice. Eliminate your answer choices first. Okay. Let's see. What did I say? Learn. What? 3 main strategies. Hold on. Learn what they are. No. I'm getting this mixed up. Oh, okay. Expected outcome. Elimination. Oh, and know what the question is really asking you. Sorry. Know what the question is really asking you. Those are the 3 things that you can use on any question. So when you come across somebody saying that you cannot use strategies for every question, say, yes, you can. Renee taught me 3 main strategies that you could use. Expected outcome, process of elimination, know what the question is really asking you because the topic may be different. So for my example is the heart failure patient that was asking me what could he eat today, and they gave me a list of foods. They had canned green beans, right? Mashed potatoes and gravy and roast beef, applesauce, and a turkey sandwich, right? And you thinking to yourself, oh my God, all these foods, I don't know. I just don't know what to choose from. Wrong. If you know the expected outcome of a heart failure patient is low sodium. So what do? You use my techniques. What you going to eliminate? Everything low in sodium. It's that easy. No, I just play it. It's that easy for that question. So, but process of elimination really helps you if you eliminate first, and if you know the expected outcome. So the expected outcome of a heart failure patient is low sodium. So eliminate the canned green beans, eliminate the mashed potatoes and roast beef and gravy. Gravy is high in sodium. Canned goods is high in sodium. Deli meat is high in sodium. I was only left with the applesauce And even if you was not sure if applesauce has sodium in it, it's the only freaking answer choice left that makes sense, really. Okay? That was on my actual NCLEX test, by the way. And I had got so good at answering questions with those three things, you know, knowing what the question was actually asking me. Like, I had to really sit down and learn foods that were low in sodium or high in sodium. Okay? I know I'm taking too long, I'm sorry. And then so learn what the strategies are, the three main ones. I just taught you the three main strategies, and then what do you have to do? Practice them. Practice makes you proficient. I'm gonna say it. I'm gonna wear a t-shirt. I'm gonna wear a hat that say the same thing. Practice makes you proficient. Stop trying to be perfect. You're not perfect in an imperfect world. Right? That makes sense? Stop trying to be perfect. You're not gonna be perfect on your tests all the time. NCLEX know that you're not gonna get every question right. They don't expect you to, but they do expect you to know the basic stuff. Just like I had another question on NCLEX that said, this is the person's labs. Which ones was most concerning to the nurse? And they gave me a glucose of 78. They gave me a temperature of 101. They gave me a potassium of 5.0. And then they gave me another normal, I think a heart rate of 78 or something like that. So the glucose was normal, so I eliminated that, right? Because the question asked me for most concerned lab. You know, I'm the nurse. I need to be concerned about one of their labs. So they gave me a regular glucose for 78. They gave me a regular heart rate. Let's say it was 110. 99. Okay, it's still normal, right? It's still normal. Potassium. So I eliminated the glucose because it was normal. I eliminated the heart rate. So, and I was going back and forth between the temperature, which was 101, and the potassium, because it was 5.0. The potassium is still normal. It's on the high side of normal, but it's still normal. I see your face, Genesis, like, wait a minute, which one would I choose? You have to recognize that stuff. The potassium, it was still normal. 3.5 to 5, right? That the temperature, they wanted to see if I could recognize which lab, even if it was borderline, which one was still, you know, which one was most concerning. Most concerning means the complication can arise from it. And so by eliminating everything else, and then I had to sit there and think about, wait a minute, y'all trying to trick me. Potassium's still normal. Temperature. That's how the answer choices are. They're very, very tricky like that. The question is so straightforward. So straightforward. But then them answer choices, you be like, nah, you tried to give me. Nah. And sometimes your nursing school stuff will be like that too. Okay. So I gave you the three main strategies, right? And then you have to learn what the other ones are. So there are more, but those are the techniques that's the how to break down your question. Okay. The three main strategies that I just gave you are like more like techniques, and that's how you break down your question. So there are more test taking strategies, like when you have a priority question, you know, what strategy should I use? Okay, well, priority, you have to know if it's acute versus chronic, if it's expected or not expected, like this. For example, and that's how my strategy video goes. I give you an example for each strategy. So in order to use expected versus unexpected, let's say a person what I can't remember right now, but dark red blood versus bright red blood. What's dark red blood? It's old. Versus bright red blood is active bleeding, right? So dark red blood is expected for which patient? Anybody know? So if you have a postpartum mom, right? Postpartum mom, she comes in with dark, not come in, but she just delivered a baby and she's still bleeding. She got dark red blood. It's old blood. Okay, you just gotta massage the fundus to get it out. But if she just keeps bleeding and bleeding and it's bright red and it's active and you don't know where it's coming from, that means she either got a laceration somewhere that needs to be stitched up, or she needs some medication to stop that bleeding. Okay? That's how you use expected versus unexpected. You use that to eliminate your answer choices. So if you have an answer choice that's saying dark red blood, you're going to eliminate it if they're asking you for a complication. Dark red blood is not a complication unless you abrupt it, whatever. But anyway, but that's more for another day. Going in depth about the strategies. It's another class. It's a video with the test taking strategies. Do all of you have the test taking strategies downloaded? Have you watched the video? Sandra, you're not shaking your head. No? Okay. Go into the group and get it. Okay, that's going to be one of your tasks. And then, but that's your techniques. You need to learn what they are for the strategies, and then you need to start implementing them. Okay? Start practicing them, because you're only going to get better at them as you go along. All right. The last things is dosage calculations. We're not going to do problems today, but I can give you some problems along with the study plan and stuff that I'm going to give you after this. So it says the technique for dosage calculations is learn your conversions. And I want you to write this down. Focus on the units of measure. Do they match? And what can you cancel? Focus on the units of measure. Do they match? And what can you cancel? So the next thing is learn the formulas, right? Everybody has their own way of doing dosage calculations. It's D over H times Q. It's what is it? Ratio proportion, dimensional analysis. Most of your problems you can do by dimensional analysis. Okay? So stick to what's best for you. If you have a teacher that come in and try to change your way of think of doing dosage calculation, no, stick to what you know. We had a teacher come in and she was like, no, you do it like this. And she was doing ratio proportion. And I'm like, that I don't know that. I don't want to do that. It looks confusing. I'm even more confused. I'm like, nah, I'm just going to stick to the way I do it. Because, I mean, like, that's how I did it. So I was used to D over H, and then I learned dimensional analysis. Now you can learn more than one; it's perfectly fine, and you can alternate between the two. Whatever, as long as you get to the right answer and you show them that you can get to the right answer, they don't care. So have a system. Write down all your formulas. So you got GTT, right, times volume over time. And then you got D over H. You got safe dose range for pediatrics. You got heparin units. You got flow rates, right? If I give 100 milliliters if I give 1,000 milliliter bag in 8 hours, what rate would I put it at? 125. 1,000 divided, what is it? 1,000 divided by, somebody do the math. What is 1,000 divided by 8? 1,000 is 125. 1,000 milliliter bag running over 8 hours, you just divide. That's it. You just divide. And it's going to give you your flow rate, 125. Okay. So you got to learn your formulas. If you have to write them down, okay, if you got to write them down and make a list of them, do it. I think I have something with all of them on there. But number 1, learn your conversions. Number 2, learn the formulas. And 3, what's number 3?
Number 3.
Huh? What's number 3 on your study plan? What do it say? What you got to do?
Practice.
Practice makes you proficient. I literally sat at the table learning all of these things. Okay, I didn't get up until I learned this stuff. Then once I learned it, I just kept doing problems after problem, after problems, after problems, after problems, until I could teach it to other people. You know, I could get up in front of a class and say, okay, if you have, 5 milligrams in 1,000 milliliters, you can't take that medication out of that milliliters once you have it in there. Keep it together. They are your married couple. They married for life. They not getting a divorce. Does that make sense? Y'all like how I said that? I learned that from my teacher. She said, anytime you see, because a lot of people have problems with how do they break, how they put together the equation. So I said, look for your married couple. If you have 5 milligrams in this milliliters, you can't take it apart. Think about it. If you have this bag and you shoot that medicine in there with that needle, how you gonna get it back out? Tell me. Right? How you gonna get it back out? You can't. They married for life. They married for life. So don't separate them when you go to write them in your equation. Dimensional analysis. Okay, so I'm weird. I always do everything backwards. My dimensional analysis may not be your dimensional analysis because I don't do my conversions inside my dimensional analysis. I do my conversions first. So if I have to convert like milligrams to grams, I'm gonna do that first. Okay, so I already got that number, and then I'm gonna plug it in. You may set up the whole thing to where you're doing a convert. Nah, that's confusing to me. My brain hurts. But if you keep your married couple together, you start with what you want to end with. You start with what you want to end with. Okay, and that's dimensional analysis. You gotta learn that stuff. Have most of the students taken dosage calculations, right? You taking that already?
Mm-hmm.
Okay, so you just gotta practice. Practice makes you proficient, right? Y'all gonna start saying that. Repetition is key to consistency. Practice makes you proficient. Yeah.
Yeah.
You guys have something like this?
Yeah.
Okay. Write it on your badge or something if you can. 1,000 kilograms equals 1,000 grams. This is literally just moving your decimal points, whichever way they ask you to move them. Okay? Or if they ask you to divide or multiply or whatever. 30 milliliters equal 1 fluid ounce. So, I mean, that's pretty much it for this group consultation. Do you have any questions? Is it clear now how to get back on track and how to study, how to pull out the information, where to go get the information, how to use the information correctly, your resources correctly. Like, I literally just jumbled all of that in 2 hours. So it doesn't matter if you have a syllabus. It doesn't matter if you're studying for NCLEX. You can get this stuff. Okay, you can. It's just up to you to organize it how you need to. Now let me see. You don't have to use this calendar, but let me see. It is a calendar for you. You can go to like Office Max or whatever like paper store you have, and you can spiral bound it, make it to a spiral notebook if you want to, and then take to class, and they're like, where you get that calendar from? But this is how it looks. Okay, students, you got a syllabus, right? You got a week to study. This is how you do it. Okay, renal, endocrine. You take a whole day. Take a whole day. Okay, and I want you to study simultaneously. Everything don't got to be one at a time. Oh, I got to focus strictly on content. No. Refresh content for like an hour, then do questions on the same content. Just see if you can recognize what's going on and if you could pick up on the pattern. If you do renal for a whole day and make notes and do questions, and then you come back before your test on Monday and do renal and look at your notes, you're going to remember it. NCLEX graduates, do the same thing. Repetition is the key. You could take a whole, because you have time, and I don't know if you guys like scheduled your tests or whatever. If you got 45 days, you could take a whole week on fundamental subject and just do a little bit at a time. Learn about your blood products. Learn about consent forms, informed consent, and when, your interventions on incident reports, informed consent. A lot of NCLEX like to ask you about conference questions. Okay, it's just teaching what you know. If you're standing up there at a conference and you teaching the whole staff about diabetes, you gotta know about diabetes. It doesn't matter where you teach, as long as you know what you're teaching about. Does that make sense? Okay, they have a lot of teaching learning questions on there. So students, if you have a week to do your subjects or whatever, you may want to do one day at a time. Or if you feel like you could put 2 in one day, focus in the morning on this subject, and then before you go to bed, focus on this subject, a different subject. By all means, do it, but I want you to include questions too. Okay? The questions will help you. You got to pay attention. The question's going to help you recognize if you're retaining the information. Did you know part of the rationale, or did you have no clue on the whole rationale? You got the whole wrong. You got the whole question wrong because you just like, what? Okay, that means if you just totally lost in your questions, that means you just don't. You have to go back and review and take more extensive notes. Okay. One more thing. Oh, no, that's it. I will send you. Can you guys give me till like tomorrow? Because it's kind of late. Give me till tomorrow evening to give you the study plan and the video. Okay, I'll try to do it. But my family is having like game night tonight or something. And they want me to drive all the way 30 minutes. So, but this is how you use your calendar. And it's going to be 30 pages. And you can do it front and back. It's nice and colorful, okay? Because remember, your brain remembers colors, right? You don't have to use it if you want to use a different planner. I mean, by all means, whatever. It's fine. But But I just like to provide tools just to help. You can even put your subject of what you're studying on that day. And key points to remember and important apps to use. An important app for pharmacology, I've said this before, is the NCSBN flashcard app. It teaches you by classification. Okay. Another important app for harder questions than Saunders, once you master the Saunders questions, is NCLEX Mastery. And it's cheap and it never expires. NCLEX Mastery is never expires. And NCSBN is free. Just download it in your app store. Yeah, I'll be giving y'all all the goodies. And would you guys believe it or not, I taught you guys, I'm going to show you. I taught you guys from this book I made. All that stuff, that study habit stuff, is all in my NCLEX bootcamp book. NCLEX does not define me. And the goal of me making this, so I just made one for me. It took me a whole year to make this. But the goal was for me to teach from this book. That's what I wanted to do. And now I'm doing it. And it's so crazy. So anything is possible. And the devil always gonna come get you when you're trying to better yourself. Okay, so just be ready. I went through every single thing you can possibly imagine except for getting beat on, okay, in my nursing journey. My dad died. My mama had a nervous breakdown. I had a newborn baby. And a boyfriend that was messing up. It's like car broke down. I had to get the clinicals, like everything you can imagine. I cussed out the clinical teacher and never went back. My first time, like everything you could imagine. Okay, I went through it. And then the second time, I had to bite my tongue a lot in that program because they could have failed me and I was not trying to fail. So, but they were sabotaging us good. And I went to ITT Tech. So they were sabotaging us good. And I'm talking about black teachers. They was the worst ones. The white teachers was good. But the black teachers, they was like sabotaging the test. They was sabotaging us in clinicals, giving people unsatisfactory when it was like satisfactory. We was like, what? And I mean, she would never mention anything. She would never say nothing. What you could approve on, nothing. Okay. So everything you can imagine is gonna happen. You just gotta keep your head up and keep going. You gotta have a good support system. If you don't have one, try to get one. Find a classmate. Okay. When my car broke down the first time I was in clinicals, I bummed rides with the clinical teacher because she was going the same way. I'm like, hey, can I get a ride with you? I did, like, hey, I was determined. I was determined to do whatever we had to do. So it worked. Till I cussed out the other clinical teacher down the line. So listen, I'm telling you, the devil gonna come for you. Just keep your head up. If you need to talk to me, just feel free to text me or inbox me, whatever. Sometimes I be asleep because I do work nights and it takes me a whole day to wake up. But I'm here for you guys if you need help, okay? And it's definitely not about the money because $37 ain't shit. But it's I'm telling you guys, it's mind-boggling. People out here charging $700 to $1,000 for the same information that you got in you paying for in nursing school. It's the same information. They just teaching it to you in a different way. That's what you're paying for. You're paying for their technique. You're not paying for their time. Don't let them fool you. You're not paying for their time. You're paying for their technique. Okay? So, yeah, I refuse to pay $1,000. I'm sorry. Oh, my God. Anyway. But, spread the word about the group consultation, because I really don't think people know what it is and what it entails. And it's very personable. A lot of people like one-on-one. And that takes up so much time when I can just teach 5 of you guys at one time. And then, you know, because everybody comes in my inbox one at a time, and I have to respond one at a time. That's what takes me so long to respond to you guys sometimes. And then I have to sleep, eat, poop, and take care of my family. Like, so spread the word. Okay. Thank you guys for coming. Thank you guys for trusting in me for your content knowledge and all this other stuff, group consultation class. And I will see you guys in the group.
All right.
Okay. All right. Have a good night.
You too.